Hi YouTube, this is me finally getting around to doing a video that I've been telling loads of people on Twitter that I was going to do for ages, which is about genital reconstruction surgery. Now straight away, there's always a controversy about the naming of this, and genital reconstruction surgery, aka GRS, is what I call it. People have different names for it, such as SRS for sex reassignment surgery, the surgery, bottom surgery, you hear it called GRS to mean gender reassignment surgery, confusingly, and you've probably got your own. But in essence, we're talking about the same thing. We're talking about lower surgery for trans women, trans feminine people. It's the creation of a vagina where there wasn't one before. So the proper name is vaginoplasty, and there's a load of other names in there as well for the various different parts of the surgery. But that's what we're talking about. Call it what you like, but I prefer genital reconstruction surgery because it's factual and doesn't make any judgments about gender or anything like that. So I'm going to cover a load of stuff in this video. So I'm going to cover things about how I made my decision to have this, how I got referred, how I picked a surgeon and hospital and all that kind of stuff, what it was like in hospital, what the recovery was like, and how I feel about it now, and the decisions that I made. Inevitably this is going to be quite UK specific, or very UK specific, indeed solely UK specific, because that's where I'm from, that's where I had it. I don't know as much about stuff in the other areas, but feel free to add stuff in the comments below if you know things about how this works in other countries, or indeed if I'm wrong. So firstly, decision making. So this can be inevitably quite a long process. People come at this from different angles. For some people it's everything they always wanted. For some people it's something that perhaps they started out thinking they didn't want and decide they did. And obviously for some people it's not for them. I think one of the things that was really important for me to think about was it's not a panacea. It's not going to solve everything. I was very conscious of that from the start. It's not compulsory. For example, in the UK, to get a gender recognition certificate, if that's what you want, to get your gender legally recognised, you don't have to have it, although it is kind of difficult to get without, which is not right, but that's the way it is. But for me, it was never an absolute desperation of something I wanted. It's something I wanted, but there's lots of things that you want that you don't really feel that you can have, and therefore so you don't get too bogged down in focusing on that's the one thing you must have. So it wasn't a desperation, but I did want it, and that that wanting it was important. I guess if I couldn't have it, I probably would have survived. My quality of life might not have been as good, and I guess at the end I'll talk about how I feel about it now. But I would have probably have survived. It wouldn't have been ideal. And I think unfortunately you can't get away from this idea that actually for me anyway, part of why I thought I wanted to do it was actually for other people. I know you shouldn't make decisions based on that, but society expects a certain gender to have a certain genital configuration, and it's kind of hard to completely factor that out of your decision making. It's unfortunate, but that's the society we live in, is that people have those expectations. I think I'd love to be able to say, no, this was absolutely just everything I wanted, but that's true. But I think I was factoring in the fact that it would probably make my life a bit easier as well in terms of other people's expectations. Just when these trans folks go to you, what genitals have you got? Well, actually, I've done what you expect of me, so I've done yours. So anyway, after having made a decision, or in fact indeed kind of at the same time as having made a decision about where I wanted this, I had to go through the whole process of actually getting referred. Now in the UK that's a very long-winded process, and in fact it's mostly waiting. Most of that is actually getting access to the Gender Identity Clinic in the first place, so the GIC. So you can typically wait anything between, I guess 6 months and 3 years these days, depending on where in the country you are and where you're being referred to. Once I got there, it's basically a case of having a few appointments with psychologists, psychiatrists, and really they're just kind of delving into your thought process, your background, your experiences, your thinking, to make sure that actually, firstly, to find out if you do want genital reconstruction surgery, because of course you might not, and that's fine. I did. And in fact, when I first started that process, I wasn't 100% sure I did, but I became sure long before the point at which it became an important decision to make. So essentially, we'll have a load of appointments with these professionals anyway. At some point, towards the end probably of these appointments, you have to have two opinions from two people who are qualified to decide that you've competently made a decision that you want to have genital reconstruction surgery and that you're a good candidate for it. So they're looking at things like, have you thought about the consequences? Obviously there are consequences to having it. There could be complications. There's obviously an impact on fertility and all that kind of stuff. So they're looking to make sure that you've thought about all of this and that you're competent to make that decision and that you've made those decisions on kind of the right grounds. I'm not going to go too much into the detail of that now because that's probably a whole other video and probably other people have done that better, but that's kind of what they're looking at from that perspective. Once that's done, they will refer you. They will actually ask you, should ask you anyway, you've certainly got the choice to ask where you want to be referred for the surgery. A little bit more on that later. But there's kind of two aspects to the referral. One is the referral from the gender identity clinic to a surgeon. And by the way, that's different if you're going private, but you still need two opinions. That's a global thing that you have to have. And then you'll need to go and see a surgeon and they'll have to be happy that you're a good candidate for surgery as well. So let's assume you've got your gender identity clinic referrals, you've waited your God knows how long you have to wait to get through, and you've gone to see a surgeon. They will have some questions as well. So they will want to check, firstly they have guidelines around BMI, body mass index, around whether you can have surgery or not. Different surgeons have different BMI numbers that they look to achieve. They're not hard and fast rules necessarily. What they're generally looking at is kind of body fat essentially in the abdominal area, and if there's a lot of body fat in that area it's more difficult to do the surgery because there's less room to work in, there's more chance of problems like kind of nicking the colon and causing problems there. You've also got problems to do with the absorption of anaesthetic. When you're under your general anaesthetic they need to use more of it if there's more body fat, so that is a higher risk. Now, this is like a slightly problematic concept because, of course, people's weight doesn't have any impact on the amount of dysphoria they have, and of course, access to surgery is a very important thing for curing dysphoria or at least mitigating it. So it's problematic, but what I'm trying to get across is these are the kind of questions that they're looking at asking. I'm not necessarily kind of making a value judgment about that. Other things they're looking at is, I guess, again, they're reiterating the risks and possibilities of stuff that could happen to make sure that you're comfortable with that. And they're also looking at the amount of donor tissue they've got to work with. Now, if you're not familiar with the way that they do genital reconstruction surgery, I'm not going to go into huge detail about that now because, to be honest, A, people don't always want to know, and B, I'm not an expert on it, so I'm not going to talk about that. But essentially, they need enough tissue in the existing genitalia that they can kind of turn it inside out and there can be enough for them to work with. So they'll have to have a look to see if they're happy with that and that they can do it. And if there isn't, then there's other techniques that they can use, but then that has an impact on things like they may need to do hair removal in the area and so on and so forth. So they will have a look and they will tell you on that. If they need you to go and get hair removal or something, then they'll tell you to go and do that. And if it's the NHS, they fund that for you, so that's fine. I didn't need to have any of that, so it's straightforward for me. So I went along. It was a very quick appointment actually. It was surprisingly straightforward, and that was that. And then they gave me a date. Now I've kind of skipped forward a little bit because prior to this, of course, I had to choose my surgeon. You are supposed to be asked because you've got a choice of which surgeon you want to go to. You won't always be asked. Sometimes you have to make sure that you can put forward your opinion of what surgeon you want to go to. It also differs depending where in the country you are. So, if you're in Scotland or in Northern Ireland, you will always be referred to the Nuffield Hospital in Brighton for your genital reconstruction surgery. If you're in Wales, you'll always be referred to, I think it's called the Imperial Healthcare Trust in London. It might have changed slightly now, but essentially you'll be referred to that and then they will farm you out from there. But essentially there is a choice of 8 surgeons in the UK. As I said, in Scotland and Northern Ireland you don't really get a choice. You get Nuffield Trust in Brighton, or not Nuffield Trust, but Nuffield Private Hospital in Brighton, and there's 3 surgeons there. And those 3 surgeons are Phil Thomas, Charles Coker and Tim Larner. If you're elsewhere in the UK, you get a choice of, generally, there's some local variation and it changes from time to time, but at the moment, generally, you get a choice of those 3. You also get at the Charing Cross Hospital in London, you get a choice of Tina Rashid or Roland Morley do genital reconstruction surgery there. Also in Parkside Hospital in Wimbledon, you get Tina Rashid again, and Roland Morley, and also James Bellringer. And then also up in Leeds, Methley Park Hospital, you've got Oliver Fenton. So there's 8 surgeons, and you can pick any one of them. Essentially, their methodology is pretty much the same. So you're not going to get a massive amount of variation between one and the other in terms of results. They've all got very good results in terms of outcomes and complications and so on. As I said, they've all got slightly different BMI requirements. If that's an important thing, they're not necessarily hard and fast rules. There are some slight differences in terms of your experience in hospital, so because of the slight variations in technique. So, for example, someone like Tina Rashid or James Bellringer will use like an anchor stitch when they're holding the neo-vagina in place. All that means basically is you can move around a little bit sooner because there's less chance of prolapse, which is basically it falling out. So yeah, slight variations in your experience in hospital, but to be honest, the UK surgeons are pretty much all using the same technique. If you go to somewhere else like Thailand, for example, or some surgeons in the US, they're using quite different techniques. Some of them require 2 surgeries and so on. But over here, we're all pretty much the same. As I kind of hinted at there, one of the considerations you might have is actually location. These surgeons are predominantly located in the southeast of England. As I said, if you're in Scotland or Northern Ireland, you'll just get referred to Brighton anyway, and so they'll have to fly you down to that. But you've got Brighton, 2 in London, and 1 in Leeds in terms of hospitals. So if that's an important factor for you, then maybe consider how easy they are to get to, and particularly if you've got problems in terms of having someone to take you to those places or pick you up, then do consider that. So what about the experience in hospital? Now, of course, I only have experience of 1 personally, but my partner had surgery in a different hospital, and so I was there for a lot of that. And so I've got, I guess, kind of first-hand experience, or certainly first-hand experience of the Parkside Hospital in Wimbledon. So I had my surgery with Tina Rashid there, and I've seen quite a lot of first-hand experience of the Nuffield Hospital in Brighton and Phil Thomas there. So pretty similar, to be honest. Like the biggest thing that kind of made me think my experience was better was actually food. So in Brighton, they don't let you have proper food for like 3 days after you've had surgery because they don't want your bowels to start up too soon. So you're basically drinking, for want of a better way of putting it, weak gravy, which is not all that, not gonna lie to you. Whereas I was on like the grilled swordfish like the day I came out of surgery, so that was pretty cool. You can move around a little bit sooner at Parkside, so normally you would be able to they'd get you up on your feet and just stood up for a few minutes just to kind of get you moving on day 2, day 2 or 3, but for me it was a little bit delayed because I had a bit of a bleed where essentially, there was more blood than there should be, so they stopped me moving around for a little bit. In Brighton you'll generally stay in a night longer just because the timeline of what happens is a bit more complex. I won't go into massive detail about what the difference in experiences between the different places is, because to be honest I don't have all the details about it, and of course it does change from time to time as they refine their techniques. But essentially the experience is not that much different. But one thing I can talk to is how I felt about mine, and really at first, particularly first after coming out of surgery, it was so much easier and better than I really thought it was going to be. I woke up from surgery and I felt sick because of the general anaesthetic, which seems to be something I generally have a problem with. But I didn't have any pain, and in fact, to be honest, I barely had any pain the whole time other than a couple of specific incidents. I felt really good. It was really nice, The painful parts were more kind of loaded towards the latter half of the week. So we were in for about a week. One was the day that the pack comes out. So inside the vagina they've created, they put a pack in there, which is basically like a kind of a soft dressing that they pack it out with to make sure it's kind of stuffed essentially and kind of held in place. And they take that out, and that doesn't really hurt. It's really weird, but it doesn't hurt. But then of course you have to do your first dilate. Now, if you don't know what dilation is, it's essentially to keep the hole, for want of a better way of putting it, from kind of the muscles from kind of closing it down a little bit and making it smaller. Crucially, the hole, it's not like a hole that's going to heal up. You hear a lot of scaremongering, like, oh, if you don't do your dilation, it'll heal up. Won't do that. That's not how things work. But you have to do this dilation, which is basically to put a medical implement in there and hold it in there for a while. And it looks like this, because that is one. So you get two. So you have to do that, and that's really weird to begin with. And in fact, it stays weird for quite a while. But that was quite painful at first, because it's like the first time, and obviously stuff's still very, very sore and tender around there. And for me, I had a big problem slightly later on than this with taking the catheter out. So obviously you need a catheter for urination, because of course things aren't going to work the way they used to like that. So taking that out was kind of weird. But I had problems where because of swelling and so on, I then couldn't wee normally, so I had to have one put back in. That was very sore. Dilation is a weird experience, and you get to do a lot of it, certainly to begin with. So like when you leave hospital, you have to do 3 a day. So like as soon as you get up, just before you go to bed, and then one in the middle of the day somewhere. I mean, you could look at it, you're supposed to kind of do them every 8 hours, but that doesn't really work. So for the first kind of, I guess, 8-10 weeks maybe, depends on your surgeon, depends what they advise, depends how things go. You might be doing 3 a day, then you'll drop to 2 a day, and then 1 a day, and then 1 every couple of days, a couple a week, 1 a week, etc, etc. So it gets easier, but the first one, like I said, the first one was weird. It hurt. I had a massive panic attack. So like they pretty much had to do it for me. I mean, they kind of do it for you anyway, because of course you've got no idea what you're doing. But it was, I had a kind of a bit of a breakdown because it was just too much. Like it wasn't so much because of pain, because there was a bit of pain, but I don't think the pain was as bad as I kind of perceived it was. It was just purely because I was having like a bit of a moment. I think that was the first time in the week that the emotions got to me and the enormity of the situation, so I had a bit of a meltdown about that, but got over that pretty quickly, and then like a couple of days later I was able to kind of do it by myself, no problem, so it's fine. Afterwards then, so after a week or so, you go home. Hopefully there's no complications, generally there isn't, in fact 99.9 whatever % of the time there isn't, but I don't know the stats, so don't quote me on that, but you go home, and for me I went home to my mum and dad's house for a bit so they could look after me, because you don't want to be doing too much for yourself in those first few days, because you don't want to cause anything bad to happen. But yeah, so the issues I had, as I touched on before, were around couldn't wee properly, and of course if you think of the amount of trauma in that area, this is one of the high risk things that can happen. So essentially I think there was just too much swelling around there, and like the urethra was kind of blocked because of the swelling. So I had to go home with a catheter in. Generally you don't. Generally they take that out, you can wee, it's fine, but I had to go home with a catheter in, and I had to have that in for a while, like a couple of weeks, week or two. Then I had to get it taken out by like a nurse locally, so I didn't have to go back to the hospital for that or anything. But I still couldn't wee, so I had to have one put back in, and that was fun because I had to go to the local A&E in the end, because like the healthcare professionals tend to panic that I haven't seen one of these special new vaginas anymore, so like I've never seen one before, so like how does it work? And it works exactly the same, everything's in the same place as you'd expect it to be. That's literally the point. But anyway, so I had to have one put back in. after a week or two, had it taken out again, still couldn't we, so I had to get like these temporary ones that you can use once and then you throw them away and do it yourself, which is weird. But anyway, after a little while that was fine, so, and it's still fine now, so it's just one of those things that, and this is, we're going back, 18 months now, it's been fine for 16 months, so one of those things. The other issue I've had again, which is quite a common complication as complications go, which is granulation tissue. So that's this, if you like cut, you get a cut on your finger or something, and then when the skin's healing up, you get this kind of white, kind of fleshy bit that kind of grows back first. It's like that, but that goes a bit crazy, and it kind of, there's too much of it, and it makes too much skin, and it's not very good quality skin, for want of a better way of putting it, so it breaks quite easily. So I had some of that. That's mostly sold now as well. I had to have a couple of revision operations, they call them. Again, none of them were particularly major. In fact, I had 2 under general anaesthetic and 1 just under a local. Pretty much sorted now. That's quite extreme, I think. I think most people, certainly most people, don't need a revision operation. Some people just need a bit of like silver nitrate just dabbed onto it, which kind of removes the granulation tissue. I wasn't lucky enough that, so I had a few more problems. But again, it's absolutely fine actually, and to be honest, like for most of that time, unless I kind of looked at it or like did something to it, I wouldn't even notice. It wasn't like it was painful or anything like that, it's just not as it should be. So I guess the big question is, was it all worth it? And the short answer is yes. So, as I said, I had a few problems. For me it wasn't like the absolute be all and end all to begin with. It wasn't like I must have this and must have this. And I have some complicated thoughts about whether that's ever really a thing anyway, but you can't judge other people. So, but I'm absolutely happy that it was the right thing to do. It's actually made more of a positive difference to my quality of life than I expected it to. I was expecting that, this will be good. And like I said, part of my thinking was, well, at least that's one less thing that people can try and invalidate me for. But yeah, actually, when I first had it, I was really happy about it. I didn't expect to be that happy about it, and even since, it's just one thing I just don't think about anymore. It's one thing that would make me upset or stressed that just doesn't really bother me anymore. So that's got to be worth it. And it's not life-changing. People seem to think it's going to be life-changing. It's not life-changing. At the end of the day, if I walk down the street now and compared to when I walked down the street 2 years ago, no one's going to notice any difference because they can't see. So it's not life-changing in that respect, but it's certainly given me kind of one less thing to worry about and one less thing to be upset about. Happy with my choice of surgeon, happy with my choice of hospital. It's just been a good decision. Even taking into account the complications, and I know a lot of people worry about complications, and I had a couple of those, but they're not lasting things, so I can't really complain too much. So I'm pretty happy about it. So anyway, if you found that useful, then let me know. Leave the video a like or subscribe to the channel, or both preferably. Leave us a comment as well. If there's loads of questions, then what I might do is do a follow-up video and answer some of them if there's enough. Otherwise, I might just answer them in the comments, which I'll probably do anyway. But yeah, please like, subscribe, comment, follow me on Twitter, ask me questions on Twitter, whatever you want. But yeah, I hope that was useful. Thanks.